My name's Marietta Swan. I'm one of the GPs at the Balham Park surgery. I will briefly talk to you about coils or intrauterine contraceptive devices, i.e. IUCDs. An IUCD or coil is a small device measuring just over 3 centimeters, which is placed in the womb. This is a simple procedure that can be done here at the surgery, at local family planning clinics, or in hospitals if needed. Broadly speaking, there are 2 types of coils. The copper coil, which as you can see is made of plastic and contains copper in the body and usually in the arms, and the intrauterine system, or IUS. The IUS available in the UK is the Mirena IUS. This coil contains a progestogen hormone in this reservoir, which is released slowly and is designed to work locally at the level of the womb. Both coils are very reliable forms of contraception. The copper coil can also be used as emergency contraception. The Mirena IUS, for instance, is considered to be as reliable as sterilization, with the great benefit that it is fully and immediately reversible. Coils work by preventing the sperm from meeting the egg. They also can prevent implantation as a backup mechanism. The Mirena IUS is also widely used for treatment of heavy periods, in some cases of endometriosis, and as the progestogen arm of HRT. Coils can be used by women who have not had children, by women who are spacing children, and by women who feel that their family is complete. If you have not had children, we recommend the Mirena IUS, as this type of IUCD is less likely to be associated to pelvic infections, which could potentially lead to infertility in the future. On the whole, coils are a very safe and reliable form of contraception, but I will now talk to you about potential side effects and risks of having a coil. In respect of the copper coil, copper coils have a tendency to make your periods heavier and more painful, and unfortunately this is a common side effect of a copper coil, so I would not recommend this method for someone who suffers from heavy and painful periods. The Mirena IUS, on the contrary, will make your periods lighter, and in about 40% of women, periods stop altogether. This is because the progestogen hormone contained in this reservoir tends to thin the lining of the womb. Common side effects of the Mirena IUS are irregular spotting, i.e. minor vaginal bleeding in the first few months after insertion. This side effect can last up to 3-6 months, but almost invariably settles, as I said, to leave you with no periods or very light periods. Other side effects possible with the Mirena IUS are slight breast tenderness initially, possibly slight mood swings, and rarely worsening acne. These side effects might occur because it is possible that a bit of the hormone get into your system initially, but this would be very minor amounts. In respect of the risks associated to having a coil insertion, I would like to point out firstly that they are rare, but I will go through them one by one. The first risk I want to discuss is the risk of pregnancy. As previously discussed, coils are very reliable forms of contraception, but no method is perfect. It is possible to get pregnant with a coil, And if you do get pregnant, you place yourself at a slightly higher risk of an ectopic pregnancy. An ectopic pregnancy is a pregnancy outside of the womb, usually in one of the tubes. If this happens, you lose that pregnancy. It's considered a gynecological emergency. You need to be referred to hospital and will most likely need keyhole surgery. A pregnancy can also implant in the womb near a coil, and if this happens, your likelihood of a miscarriage is greatly increased. In respect of pregnancy and coils, I'd like to say that if you ever develop a pelvic pain when you have a coil, it is important that you exclude the possibility of a pregnancy by doing a pregnancy test or by checking when your last period was. I will now talk about the risk of infection with coils. This risk is higher in the first 3 weeks after a coil has been inserted and relates mostly to your risk of having sexually transmitted infections. A coil has the potential to make a sexually transmitted infection a worse infection. It facilitates ascension into the tubes, and this can cause tubal inflammation, which could lead to tubal blockage and ultimately infertility. This is especially relevant for women who've not had children, and in this respect, we recommend the IUS as a preferred option for you because the IUS forms a mucus plug at the level of the neck of the womb, which tends to prevent infections from ascending into the womb. I will now discuss the risk of perforation. This is risk of damage to the uterus at the time of insertion of the coil. The coil goes through the womb and ends up in the pelvic cavity. This is very rare. Perforations happen about 1 in 1,000 insertions. However, if they do happen, it does require you to go to hospital to have the coil retrieved from the pelvic cavity by keyhole surgery. The last risk I want to discuss is the risk of expulsion of the coil. This means that the coil falls out of the womb. Of all the risks, this is the slightly more common one. It happens in around 5% of cases. If it's going to happen, it most commonly happens in the first 2 to 3 months. After that, it would be very rare. The only issue about expulsion is that there have been cases where the coil has fallen out and the woman has not been aware of this and obviously has continued to have sex and fallen pregnant. In respect of this, we teach you how to feel for your threads so that you should do this once a month, especially initially, usually after a period, and then you can have the certainty that the coil is in the womb. I will now talk to you briefly about the procedure, which is in fact not dissimilar to having a smear, but it can cause more crampy period-type pains, for which I recommend you take a couple of Nurofen an hour before you come. At the time of the procedure, a speculum is introduced into the vagina to obtain a good view of the neck of the womb, and then the inserter is gently introduced into the womb and the coil carefully released. And then the inserter is removed and the threads are cut about 1.5 to 2 centimeters from the neck of the womb, so they end up high up in the vagina. About 4% of women feel slightly faint after this procedure. In fact, some women do faint, so I recommend you don't drive or use machinery the couple of hours following the procedure. If you feel you have enough information and would like to go ahead and book your coil insertion, I suggest you call the surgery and ask to speak to our senior healthcare assistant. It will be important that we know that there is no risk of a pregnancy when we go ahead and book this appointment. In that respect, the best time to insert a coil is at the end of the period when you're bleeding slightly but not heavily. If you are using a reliable form of contraception, we can book the procedure at any time. This is a copper coil. As you can see, it is made of plastic and has copper in the body of the coil, and most copper coils also have copper in both arms. This is a Mirena IUS. It has a reservoir which contains a progestogen hormone, which, as I have explained, is released slowly locally at the level of the womb. If you feel you would like to discuss things further, please feel free to contact me at the surgery. This can be done by phone or in person by you booking an appointment to see me. If you have not had children, I would like to talk to you before we go ahead and book this procedure. So I would encourage you to call me or book to see me.